Have you ever needed medical assistance but didn't receive any because of the cost? Many Americans don't receive the medical help that they need because of the high cost associated with it, even if they have insurance. This past year, I've had a lot of visits to the ER and specialty doctors. Without my parents' financial help and insurance, I wouldn't have been able to afford these visits. The United States needs to reform their healthcare system because there are millions without insurance and the healthcare costs just keep rising. According to a survey done by the Centers for Disease Control and Prevention done in 2020, there are at least 31.2 million people under the age of 65 who are uninsured. The Affordable Care Act, or ACA, was an effort to address these gaps in our healthcare system. With the ACA, uninsured elderly Americans declined by at least 20 million, reaching a historic low in 2016. However, by the start of 2017, uninsured non-elderly Americans went up for 3 years straight, growing from at least 26.7 million in 2016 to 28.9 million in 2019. The uninsured rate increased by 0.9% from 2016 to 2019, from 10% to 10.9%. Tolbert and Origria, 2020. The uninsured population consists of non-elderly adults and working families. Those who are more likely to be uninsured are low-income families and people of color. If we look at uninsured rates geographically, people living in the South or West are more likely to be uninsured. You may be asking yourself, so why is healthcare so expensive and why do the costs just keep rising? Well, let's look at some numbers. In 2019, the US spent at least $3.8 trillion on healthcare, which was an increase of 4.6% from 2018. This means an individual spent at least $11,582 on their health in 2019. One reason that healthcare costs are increasing is because of government policy. With the implementation of Medicaid and Medicare, providers have been able to increase prices. On top of this, a study in 2017 done by the Journal of the American Medical Association, or JAMA, pointed out 5 key factors that were linked to healthcare costs increasing from 1996 to 2013. These 5 factors are service price and intensity, population growth, population aging, disease prevalence or incidence, and medical service utilization. A more recent study performed by the Peter G. Peterson Foundation blamed 3 factors found by the JAMA as the driving factors for healthcare costs increasing. These factors being population growth, population aging, and rising prices. As populations expand, healthcare becomes more expensive due to people living longer and getting older. 50% of the rising healthcare costs comes from increased costs for services, like inpatient hospital care. The JAMA authors say that diabetes is the medical condition responsible for the biggest increase in spending over the time the study was done. From 1996 to 2013, the cost to treat diabetes increased by $64.4 billion, and $44.4 billion of those dollars were only on the medication alone. How are we going to reform our healthcare system? There are a few different proposed ideas for reforming the United States healthcare system. One suggestion is that we need to focus on primary care and something called a medical home. Any successful health system reform designed to achieve healthcare coverage for all must re-emphasize the centrality of primary care, reinvigorate the primary care infrastructure in the United States, and redesign the manner of primary care delivery and payment. AAFP Home 2019. Focusing so heavily on specialty care has created a disconnect, which results in lower quality of care and increased cost in primary care. Studies have shown there are a few steps that primary care practices can take that will not only improve the quality of care provided, but the cost efficiency of it as well. These steps are making care more accessible, promoting prevention instead of intervention, proactively supporting patients with chronic illnesses, and teaching patients how to self-manage and make intuitive decisions. A medical home creates a partnership between a patient and their primary care physician, and if need be, other members of their medical team. Universal health care is a basic human right, and it is essential to a life worth living. There is a plethora of steps that the United States needs to take to reform their healthcare system. Not only will it be beneficial for the individual, it will also be more cost-effective for the government in the long run. I hope that you will walk away from this with a new perspective on universal healthcare. No one should have to suffer because they cannot afford insurance or a doctor's visit.